Hi, thanks for being willing volunteers to help us videotape what a cognitive lab is. And in case you're wondering what it is, I'll explain it in a minute, but if you would each introduce yourselves so we all know who is here today.
I'm Amanda.
I'm Abinay.
Olivia.
Avery. Shane.
And our instructor.
Bill. Demers.
And we're here at Littleton High School. So what we're going to do is something called a think aloud or a cognitive lab. And cognitive labs are used to find out why people check things off on a survey. So when they do national surveys, they do focus groups to find out, well, why did you check this answer or that answer? Sometimes testing companies use cognitive labs to find out if the tasks they're giving students to do are clear. So what we're going to ask you to do today is do a practice run-through of a task that your instructor has developed, and we're going to ask you for some feedback on it. There'll be times we might interrupt you a little bit and say, were the directions clear, or did you have any questions, or what was easy about this task? That's basically what it is. So a think aloud is just asking you to uncover your thinking. For example, if I said, how would you multiply 25 times 7? You'd probably be just doing it on paper. But if I said think aloud, you'd say, well, I'd say 7 times 5 is 35. I write down a 5. I think I have to keep track of that 3. That's all a think aloud is. So just saying what you're thinking. Okay? Any questions about what we're going to be doing today? No. Do you want to explain what the first scenario is going to be? We're going to do a little scenario in health sciences.
So we've had a chance to discuss this scenario ahead of time. So you're a little familiar with it. It's the same scenario. The only difference between the two scenarios will be the pathogen that you're going to be providing education for. So I'm going to go ahead and I'm going to read what the situation is that you're going to be finding yourself in today out loud. As a nurse responsible for the care of a post-surgical patient recently diagnosed with MRSA, will be our first pathogen. Your patient is being discharged and their family is present. During review of the discharge instructions, you notice that the patient's family appears apprehensive, but you're unsure why. After questioning the family about what their concerns may be, you identify that the family has concerns about what their loved one has for a disease and is it catchy. You then identify that this is an excellent opportunity to teach your patient and their family about the diagnosis as it applies to the chain of infection, control of spread, and growth of microorganism, and demonstrate and teach your patient about applicable transmission-based precautions as required. The other illness we'll be doing is whooping cough, Pertussis being the correct name for that. So they've had a chance to both become a little bit familiar with the subject matter along the way by completing phase 1, as we mentioned earlier in this video segment. So having heard the instructions, are there any questions that come to mind? No. You're all pretty comfortable with that? You get what you're after? All right, then I think that would be it.
Okay, let's get started.
Come in.
Provide for privacy. Hi Olivia, my name is Amanda. I'm the nurse in charge of your discharge information today. You are being discharged from med-surg.
Yes.
You are on a IV antibiotic.
Yes, I was.
Alright, so we're going to change that to pill form so you can bring it home with you and continue that.
Okay.
You have a follow-up appointment in 1 week?
Yes.
Alright, so you're on the antibiotic for MRSA, also known as methicillin-resistant Staph aureus. Do you guys know anything about that?
Isn't that like a superbug?
Yes, and it's transferred from person to person through skin-to-skin contact, or if you have any wounds, like the drainage from it. So I'm going to show you how to use personal protective equipment to keep you safe at home, okay? So grab a gown. Okay, so you can just take it out. It doesn't matter how you take it out. Alright, open it up. Best way to do this, you can start by putting your arms through. And then you put this little thing over your head. And then there's little things so you can tie it in the back. little thumb holes that you can put your thumbs through.
Oh, see that.
Alright, so if you grab gloves, the reason for the thumb holes is so that there's no skin in between both. And if you have different gowns at home or anything, you want to make sure that there is no skin showing between the two, because that is an area where you could catch MRSA. And this is basically it. Do you understand it all?
Yep.
Alright, you do not need a mask or anything since this is just a contact precaution. If it was something else, you would. Alright, so to take these off, you want to make sure you do it correctly so that you don't contaminate any of your clothes or anything. So you can start by grabbing right here and just pulling it away from you till it snaps. Yep, and then you grab right here and pull it from the top. And then you want to try to fold it inside of each other. And then on the inside of your hands, it's all clean and everything. So you can just pull one glove off and then pull the other one off. And then just throw it right in the trash. Perfect. Do you have any questions about that at all?
Nope.
Alright. Did you have any questions about MRSA at all?
Yes. How long do I have to worry about infecting other people for?
Well, here is a brochure for both
Thank
of you.
you.
If you have any more information apart from these questions, you can go on to the CDC website and type in MRSA and it will give you everything else. But as far as how long, it's going to be depending on you personally and the antibiotics. So at your 1 week follow-up, they'll have a better understanding of how long it will be.
Okay.
Anything else?
Do I have to wear a gown and gloves at all times in the house?
Since it's skin to skin, you only really need to wear it when you're going to be touching her or taking care of any of the drainage or anything like that. But if you are worried about an object or something like that, like it's not really going to matter. But if you'd like to anyways, you can use like bleach wipes at the store, or if you make your own, you just need 10% bleach and 90% water, and that is going to be perfect to get rid of anything that could possibly get on there.
I do have another question. My husband and I were gonna go on a trip in a couple weeks, and I was wondering if I could go swimming.
I would stay away from swimming and hot tubs or anything like that because you can transfer it that way. But in a few weeks, it would really depend on how you've gotten over it and everything. So I would ask again in a week at your follow-up, ask your doctor, and he may want to see you again before you go on the trip.
Okay.
Anything else?
Nope.
All right, and you're all set to go.
Thank you. Come in.
Hi, my name's Shane. I'm the nurse in charge of your discharge information today. So you just getting discharged from med-surg, and you were diagnosed with pertussis, which is also known as whooping cough. You've been taking antibiotics in a pill form for the past couple of days.
Yes.
We're gonna give you a prescription of that, and you're gonna keep taking them so we can get this all cleared up, okay?
Okay.
Do you have any questions about pertussis?
I have a 3-year-old son at home. How easily can it spread to him?
Now, has he had all his shots and immunizations?
Yes, he has.
So he should be covered anyway, but still the best way to protect is PPE, so you can still put it on just in case.
What's PPE?
Personal protective equipment.
Okay.
And have you got all of your shots and immunizations?
I believe so. I did.
So we can check that record for you just to make sure, and just see if you're covered or not.
Okay.
So, what we said earlier, the best way to protect is personal protective equipment. I'm going to show you guys how to put that on, okay?
Okay.
So you're going to need a gown, a mask, and a pair of gloves. So I'm going to open it up. Put your arms in first. Put your head over. Put a pair of gloves on. You actually put the gloves on after you put the gown on, so you can make sure that your thumb is in this hole and that your wrist is always covered.
Okay.
So when you're at home, if you don't have the thumb holes or anything, just make sure you pull your gloves down to make sure that everything stays covered up.
if the gloves here, should I just
You
get
should grab a
one
new
on?
pair. So you just apply the mask. So when you take it off, you want to mask is the last thing you take off, so you're going to take the gown off.
Okay.
You want to make sure you pull it down first, away from your body. And you start crumpling up. And you want to try and just touch clean stuff.
What's clean stuff?
So that's the inside of the gown that wasn't contaminated.
Okay.
You want to roll it up. So then everything on the inside is all clean for you. So you can just slip a finger in, take it out, dispose of it. You can take your mask off now too.
Is there any way I should hold it?
You can just break it off and throw it in the trash.
Okay.
So using the proper PPE or personal protective equipment is the best way to protect against spreading this. And do you guys have any further questions?
Should I let my neighbors know that my wife has pertussis?
So if your neighbors come over, you should tell them, make them aware that she does have it. As long as they're all caught up with their immunizations, then they should be all set. But just in case, they should wear the proper PPE, or she should.
Okay.
You guys all set? We do have some brochures for you. All of our information was pulled off the CDC, so if you have any more questions, you can either look it up yourself or you can call us at any time.
Okay. Is there any certain type of mask that we have to wear?
Nope, it's just droplet precautions, so all you need is a regular surgical mask.
Okay.
So you guys are all set.
Thank you.
Okay.